Let's talk about those first 2 days with your new baby. That time in the hospital can be a total whirlwind, right? So today, we're going to break down exactly what happens in a U.S. hospital step by step to get you feeling totally prepared and confident. I mean, after all the planning, all the waiting, your baby is finally actually here. It is just such a huge emotional moment, the very peak of this whole incredible journey. But then, amidst all that joy, the activity starts. You've got doctors, nurses, there are tests happening. It can feel like a lot. So, what's really going on with your newborn during that time? Okay, let's get into it. And right off the bat, here's the single most important thing to know. The medical care your baby gets is the same for every single newborn. It's a standard, proven plan to give every infant the best possible start. There are no special or different procedures. So, let's start at the very beginning, like the moments right after delivery. This first round of procedures is all about giving your baby immediate protection as they get used to the big wide world. The first thing doctors are looking out for is something called VKDB. See, babies are born with super low levels of vitamin K, and that's the stuff that helps blood clot. So while it's pretty rare, this can lead to some really dangerous bleeding if it's not addressed. And the solution? It's actually incredibly simple and effective. Just one quick little shot of vitamin K. That's it. That one shot gives your baby all the protection they need until their own body starts making enough. It's a tiny pinch for a huge, life-saving benefit. And just so you know, this isn't some new experimental thing. The CDC points out this has been the standard of care for newborns since the 1960s. We're talking decades of this procedure, safely protecting millions and millions of babies. All right, next up, the erythromycin eye ointment. Pretty soon after birth, a nurse will put a little bit of this antibiotic ointment in your baby's eyes. It's completely painless, super fast, and it protects their eyes from any potential infections they might have picked up on their way out. And within that first day, your baby will also get their very first vaccine, the first dose for hepatitis B. The CDC recommends this for absolutely all newborns to give them really strong early protection, no matter what. Okay, so that's all the immediate stuff. Once that's done, the focus kind of shifts to a series of really important screenings that usually happen sometime between 24 and 48 hours after birth. This is one of the most amazing public health tools we have. A nurse takes just a few little drops of blood from your baby's heel, and from that tiny sample, they can screen for dozens of rare but really serious conditions you'd never see just by looking at the baby. Finding these things early is absolutely critical. Now, here's something you'll want to keep in mind. The exact rules for this can change depending on where your baby is born. Like in California, they just do the one test in the hospital. But right next door in Arizona, they actually require a second test a little later on. So it's always a good idea to just check what the specific rules are for your state. So what exactly are they looking for? Well, it's a whole panel of things, like PKU, which can affect metabolism, all the way to really serious conditions like sickle cell disease and cystic fibrosis. Catching these things in the first few days of life can literally change everything for a child. Okay, next screening is for hearing, and this number just shows you how routine these tests are. More than 98% of all newborns in the U.S. get their hearing checked. I mean, that's basically every single baby. And don't worry, the test itself is a piece of cake for the baby. It's completely painless, and they usually do it while they're sleeping. They just put a tiny little probe in the ear to check for a response. Finding any hearing issues this early is so important for their development down the line. The last big screening is for CCHD, or serious heart defects. And again, it's super simple and non-invasive. They just put a little sensor, you've probably had one on your own finger, on the baby's hand and foot to check their oxygen levels. A low reading can be an early warning sign that something's up with the heart, so they can get help right away. All right, so we've covered a lot of the medical stuff. But not everything that happens in the hospital is about tests and shots. There's a huge focus on things that help comfort your baby and really kickstart that amazing bonding process. Now, this might actually surprise you, but most hospitals now wait a good 12 to 24 hours before giving the baby their first bath. The World Health Organization even recommends it. See that kind of cheesy white stuff on their skin? It's called Vernix, and it's like a super-powered natural moisturizer and protector. Waiting to wash it off helps the baby keep their body temperature stable and their blood sugar regulated. And of course, there's skin-to-skin care. Placing your baby right on your bare chest, this is just pure magic. The science on this is amazing. It helps regulate their heart rate, their breathing, their temperature. It calms them down and it just floods both of you with bonding hormones. It's one of the best things you can do in those first hours. Okay, we're on the home stretch. We've done the medical checks, we've done the comfort and bonding stuff. So what's the last hurdle you have to clear before you can finally pack up and take your baby home? Before you can be discharged, every single baby gets screened for jaundice. It's super common, and it's caused by this substance called bilirubin building up. The test is really easy. It's either a quick little scan on their forehead or a tiny blood test, just to make sure those levels are in a safe range. So really, that's the key. Getting a normal result back from this jaundice test is basically the final medical green light you need from the hospital. It's your ticket out the door. But hang on a second. All of these procedures we've talked about require your consent. That brings up a really important question, especially if you're an international parent or live far away. What happens if you can't physically be there to sign all the forms? And this is the answer. A power of attorney, or POA, is a legal document you set up beforehand. It gives someone you trust, like a family member or maybe someone from your agency, the legal power to sign for your baby's routine care. It's a lifesaver for making sure nothing gets delayed and your baby gets everything they need right on time. So there you have it. From that first vitamin K shot to the very last jaundice check, every single step is designed to keep your baby healthy and safe. And hopefully, knowing the what and the why behind it all helps turn any of that uncertainty into confidence. And it frees you up to just focus on the most important thing of all, welcoming your brand new baby.